Our first presenter will be Tracy Carluccio. Tracy is the Deputy Director of the Delaware Riverkeeper Network, where she has worked as an environmental advocate since 1989. Delaware Riverkeeper Network is a nonprofit membership organization working throughout the entire length and breadth of the Delaware River watershed to defend its outstanding values and restore them where they need it. Tracy works for the watersheds protection in New Jersey, Pennsylvania, New York, and Delaware, addressing issues that include water quality, healthy habitats and communities, environmental regulation and policy, clean, efficient, and renewable energy, and biodiverse ecosystems. She has worked on PFAS issues since 2005 and has commented and written extensively on community and regulatory matters related to these compounds in New Jersey, Pennsylvania, and Delaware. She serves on the New Jersey Department of Health CDC Biomonitoring Advisory Committee on PFAS. Thank you for being here, Tracy.
Thank you, Laurel, and thank you to the Academy for the opportunity to address PFAS in New Jersey from a community perspective. Like PFAS, New Jersey's is a complicated story. For context, New Jersey is the most densely populated state in the nation. It has the greatest number of Superfund sites, and it has the 5th highest cancer rate. It carries a heavy burden of industrial pollution, both legacy and current. The state has taken bold and groundbreaking actions regarding PFAS regulation and cleanup. Yet in some important ways, we are behind in investigating and addressing the health effects for the enormous number of people who have been exposed. New Jersey was the first state to adopt a mandatory maximum contaminant level for any PFAS compound. Now has strict safe drinking water standards for PFNA, PFOA, and PFOS, and has instituted an exemplary body of regulation, in large part driven by the Department of Environmental Protection and the Department of Health scientists and researchers who are recognized nationally and who have changed the course of the national PFAS story. And the New Jersey Attorney General is forcing PFAS dischargers to be accountable, most recently with lawsuits against the federal government for military facilities and against Solvay. But the story of PFAS has been driven by the people of New Jersey and the impacted communities here, and it isn't fully revealed yet. It won't be revealed until the public has access to information now hidden from view and until blood sampling, health studies, and medical monitoring are carried out on a large scale. A couple of New Jersey unique circumstances illustrate how important, how critical public disclosure is of information and why communities need this knowledge. Solvay. This is a shameful story of a company that released PFAS for decades, contaminating drinking water for more than 50,000 people in the region around their manufacturing plant, revealed in 2013. Solvay is one of the 5 companies New Jersey issued directives to in 2019, requiring Solvay, DuPont, Dow DuPont, Chemours, and 3M to provide information about their generation of PFAS. Solvay has not satisfied New Jersey's requests, so the state sued them in November of 2020. The company has kept secret critical aspects of their manufacturing, claiming so-called replacement PFAS compounds' specific chemical identities are confidential, trade secret, and proprietary. These replacements, and a tragic irony, were supposed to be a safer alternative to the PFAS they were using to make plastics, including PFNA and PFOA. So those 50,000 plus people exposed to PFNA, a 9-carbon chain compound that's more toxic at lower doses than PFOA, which was also released, are now learning they have also been exposed to a newly discovered chemical, additionally burdening this already unjustly and disproportionately impacted community, some of whom are defined as an environmental justice community. It gets worse. Toxicological studies show that these so-called replacements are just as toxic as PFNA and PFOA, and maybe even more so. Insult to injury, the compounds called CIPFPECASs for short, being kept secret by Solvay is retarding the effort to use an analytical method for measuring the compounds in water. Without this, you can't find the chemicals in water reliably. And there's no way to know how to accurately test people for the body burden of the compounds, evaluate blood sampling, and understand how to conduct effective medical monitoring. Solvay's intractable stance is preventing the public, scientists and health professionals, even agencies, from obtaining the essential information needed to even begin to address this new contamination fiasco in New Jersey. Remarkably, we wouldn't even know about these new contaminants if it weren't for intrepid scientists from the Environmental Protection Agency and New Jersey DEP, who did the painstaking forensic investigations that discovered these CIPF PECAs in the soil and groundwater around Solvay and in private drinking water wells in the region. They even found the fingerprinted replacements on the far borders of New Jersey and in New Hampshire, apparently spread all the way there through the air, exposing even more people. And a perverse twist of this story is that Solvay has even been using the replacements before they stopped using PFNA in 2010. So people have been exposed to this 7 to 10 carbon chain compound, maybe for decades, but for years before, for a very, very long time, increasing body burdens and environmental pollution and begging the question of whether these were really replacements at all. EPA rapidly approved these replacements, like they have for so many other replacements, without adequate toxicological study. Yes, Solvay deceived the agency by not revealing the toxicological and health studies they had in hand. But EPA was negligent. They approved compounds with a dirty secret that people were not going to be privy to, depriving people of the right to know what is in their water and what is in their air. Why is it so important for people to understand the pathways and the routes of exposure? Why should information be shared even when the full picture of a compound is not known? Because ignorance is not bliss. And informed person can decide, even with the limited information available on the replacements, for instance, if they want to avoid tap water, if they want to install home treatment, move out of the area. And a woman of childbearing age can make more informed decisions about planning pregnancy, or whether as a new mother she wants to breastfeed or bottle feed, and other family decisions that directly affect their families and those who can't make those decisions for themselves, the fetus, infants, and children, the populations most vulnerable to PFAS toxicity. Finally, I have another illustration of why health testing and information is so important to people. Because without knowing, nothing happens, nothing changes. The military bases in New Jersey are culpable for contaminating the environment and water supplies, but what should have been an emergency level campaign by them to uncover PFAS contamination in New Jersey languished under the weight of a huge federal bureaucracy, a bureaucracy that was more concerned about not admitting responsibility or taking a more strong stand one place that they then would have to follow in another place than taking action that was so urgently needed. As in other places across the nation, the use of aqueous film-forming foam for training and for fires released ungodly amounts of PFAS into the environment, and it has found its way into the groundwater and water wells in New Jersey. The military knew about the toxicity of the firefighting foam for decades, but kept it under wraps and wantonly used these toxins anyway. In New Jersey, the military did agree to implement the state's adopted maximum contaminant levels for PFOA, PFOS, and which are stricter than EPA's HAL. But then they didn't follow through to address the cleanup of the contamination and to adequately replace contaminated water supplies. So New Jersey then had to sue the federal government in January of this year to force action. Once again, the truth was swept under the rug for years, and without knowing it, people are drinking water that could be contaminated at levels adversely affecting their health and increasing their risks of developing disease known to be linked to these compounds. In closing, I want to include an issue I brought up at the top. There has been scant blood testing in certain areas. There has been some important testing done in the areas around Solvay, and those assessments have yielded important information. But health studies and extensive blood sampling and medical assessments have been limited in New Jersey. And while these important couple studies have gone on around the Solvay plant, the current ATSDR funded study has been understandably delayed by the pandemic. And now the so-called replacement compound is a wild card that means we won't even have an accurate, comprehensive picture of that exposure even after the current study is completed. And there has been no health or blood studies done at all in the original hotspot in New Jersey discovered in 2004 and 2006 by Delaware Riverkeeper Network. And that's around the DuPont plant in Deepwater, New Jersey on the Delaware River. People there seem to have fallen between the cracks, and it's disgraceful. Thank you for the opportunity to hear the stories of other community representatives today and to join this panel here today to talk about PFAS in New Jersey. It's a story of epic proportions shared with people across the nation while being unique and very complex in a Jersey sort of way. Thank you, Laurel.
Thank you for your presentation and for sharing your perspectives and experiences from New Jersey, Tracy.